going to read 6 or 7 pages of material that has to do with working with trauma using somatic breathwork and the continuum of awareness. And this is from a class that Perry Holoman and Johanna Holoman taught at Esalen Institute. I think it was 2013. It was a week-long seminar. It was a really impactful seminar for all of us in attendance. And I recall that Perry handed this paper out and we took turns reading from it. So it was that important to really get across the material in this, having to do with boundaries and being present and what the continuum of awareness is composed of. And I'm not sure if Perry wrote this or if this is George Downing's work. It's not credited, so I'm going to read it, certainly for my own learning. And if Perry's okay with it, I'll put it on the internet as well, and other people from class can tune into it if it's of service, because this is a work that I've really been wanting to offer people on top of massage. It has to do with a guided meditation, a guided continuum of awareness, dropping in, and a couple of rounds of 1 or 2 rounds of about 60 deep circular belly breaths, and then another touching in with the client patient to inquire what's here now, what is present now, after achieving potentially an expanded state. So without further ado, working with trauma using somatic breathwork and the continuum of awareness. Trauma often results in a disruption of an individual's natural capacity for self-regulation and a contraction of their conscious experience. This contraction can manifest as a narrowing of awareness to only a few aspects of experience at a time. Often physical sensation, overwhelming affect, or dissociation. Our work in somatic breath-based trauma resolution involves supporting our clients in gradually restoring a flexible, grounded, and spacious awareness of their inner experience. The therapeutic relationship forms the foundation of this work. Clients must experience a sense of safety, attunement, and trust with us as practitioners in order to do the self-reflective exploration necessary for trauma healing. We help our clients establish the capacity to stay present with their experience rather than reverting to survival-based autonomic responses or dissociation. Breath, sensation, imagery, and cognitive reflection form the basis of our work. As practitioners, we must develop the ability to help clients modulate the depth and pace of their experience so they do not become overwhelmed. Supporting our clients in rebuilding autonomic flexibility, the ability to shift between sympathetic activation and parasympathetic regulation, is essential in restoring healthy self-regulation. The following material outlines principles and methods for working with trauma using somatic breath and the model of the continuum of awareness. Modulation, managing the depth and pace of self-exploration. An important barrier to healing for clients dealing with symptoms of trauma is the tendency toward overwhelm as they explore their experience. Difficult emotions such as anxiety, fear, shame, helplessness, anger, and rage can co-arise with memories of the traumatic event and its aftermath. Because trauma sufferers are consistently in the grips of the sympathetic portion of their autonomic nervous system, that part dedicated to dealing with situations requiring us to fight, flight, to fight, flee, or freeze in order to survive, strong emotion can more quickly overload the central nervous system, triggering a state of overwhelm. Overwhelm is never a productive state for people suffering from PTSD and can actually intensify the traumatic symptomology of our clients that our clients come to us for help in resolving. The autonomic nervous system is divided into two parts, sympathetic and parasympathetic. The sympathetic portion supports survival mobilization, and the parasympathetic portion supports healing and regeneration during times of rest and relaxation. When healthy organismic self-regulation is happening, individuals recognize situations where danger is present, requiring a sympathetic fight, flight, freeze response. They are also able to rest, relax, and rejuvenate, capable of moving into parasympathetic functioning appropriate to the situation in which they find themselves. This movement back and forth between these two centers of autonomic functioning, appropriate to one's context, is an important process that we call autonomic flexibility. A loss of autonomic flexibility is one of the main features of trauma-related symptoms and PTSD. Helping our clients restore balance to their autonomic functioning is crucial in restoring healthy organismic self-regulation. Somatically based self-exploration is a powerful tool in reestablishing autonomic flexibility, and helping our clients learn to modulate their experience is a key second step, supporting clients in doing self-reflective work within safely structured space. Modulation has three basic components. 1, slowing the pace of our client's experience. 2, separating strong affect like fear and helplessness from sensation, breath, and movement. 3, teaching our clients how to enter and exit their self-exploration on their terms, rather than on the terms of the traumatic cycle of experience. Assessment. 5 levels of consciousness. As we bond with our clients, we already begin the process of assessing their capacity for self-reflective work. As noted previously, our client's capacity to bond relationally tells us a great deal about their capacity to do presence-centered self-exploration. Another tool at our disposal in terms of assessment is a model of consciousness created by George Downing in his groundbreaking book, The Body and the Word in Psychotherapy. This model is quite useful for body workers because of its simplicity and clarity. Downing describes our conscious experience as divided into 5 basic categories. 1, verbal cognitive. 2, imagistic cognitive. 3, sensation, body surface as well as body internal. 4, emotion. 5, movement and motor. If all 5 levels of consciousness, of conscious experience are available to us, then the potential for our effective self-exploration across the continuum of awareness grows exponentially. Quite often, particularly in work with trauma patients, 1 or more of these 5 capacities reveal themselves to be offline or exhibiting some kind of distortion. Typical examples are an incapacity to experience sensation generally or in specific areas of the body, difficulty in articulating one's experience verbally, a shutting down of emotion, or conversely, difficulty in regulating emotional expression, as in panic attacks or helpless depression. Movements like nervous tics, twitches, facial expressions, and or postures belonging to the traumatic cycle of experience. The potential for effective self-regulation to be restored rises dramatically as consciousness expands into all 5 levels. We assess the availability of the 5 levels in 3 different ways. 1, are all 5 levels represented in our client's experience? 2, can our client move from one level to another, supporting the continuum of awareness wherever it needs to go? 3, can our client work with more than one level at a time? For example, feeling an emotion and expressing it verbally, and possibly exploring it through movement? If we have effectively bonded with our clients, we can begin to assess the capacities of consciousness they bring into the relational field as we help them learn to modulate their experience. That all sounds like a lot, which it is. However, as advanced practitioners of the somatic arts, it is incumbent upon us to understand what is required for our clients to do effective inner work. Working with trauma, theory becomes method. Let's begin with a brief map for the process of working with trauma. 1, the purpose of our class, however, is to learn basic principles of working with trauma, which are not simply dependent upon appropriate use of hands-on trauma-related work. 2, first, it is crucial in trauma work that our clients experience bonding, trust, relative safety in the presence of the practitioner. 3, once a trustworthy bond has been established, the relational container becomes the secure base from which our clients can safely explore deeper self-inquiry. 4, the structure of the work helps to orient and ground their experience. 5, the slowing of pace and our establishing of modulation support the pace and depth of their exploration. Working with trauma, theory becomes method continued. The trauma itself is a somatically organized phenomenon that always reflects old patterns of survival. These patterns express themselves in our clients' bodies as postures, gestures, habitual patterns of breathing, and emotional expression or suppression. Working with trauma somatically requires us to help clients recognize and experience these survival patterns so that they can differentiate them from the present moment. This differentiation is crucial in restoring a sense of autonomic flexibility and self-regulation. Breathwork in trauma-based sessions. Breath is a fundamental tool for orienting the function of breath back into the body process. Deep bodywork by itself is not always the most effective tool in trauma cases. When combined with somatically oriented awareness, breath can help deepen our client's self-exploration. It is always important to pay attention to our client's internal experience as we introduce or modify their breathing. As practitioners, it is important to be able to stay with our client's unfolding experience. Experientially oriented interventions. We guide clients to notice what is happening in their bodies, verbalize as needed, follow shifts of sensation, imagery, emotion, or impulse without forcing change. Our is to help clients slow down and differentiate their internal states so they can recognize survival-driven patterns when they arise and not be taken over by them. This allows clients to begin to expand their capacity to experience themselves safely. The following lines are reconstructed by ChatGPT. This was from a printout that was kind of weathered. When clients are able to stay present with their embodied experience, subtle shifts begin to occur in their breathing, posture, and tone. This is part of the self-organizing nature of trauma resolution. We are not imposing change from the outside. We are supporting the client's innate healing intelligence. In this way, the technique is less about what we are doing and more about how we are supporting awareness. Phase-based body process during trauma breathwork. When working with trauma clients using breath and somatic awareness, it is useful to recognize that the body process often unfolds in 3 phases. These phases are not forced or directed. Rather, they emerge spontaneously as the client maintains contact with their inner experience. The 3 phases are 1, incubation phase, 2, trembling, discharge phase, 3, emotional phase. 1, incubation phase. The incubation phase is characterized by quiet inward attention, minimal movement, subtle shifts in sensation, a feeling of waiting or simmering. During this phase, the client may notice subtle sensations, tingling, warmth, pulsing, detect images or fleeting memories, become aware of emotional tone but not yet full expression. Our role is to help the client stay in contact with these subtle experiences without rushing or intensifying the breath. We do not move the client into deeper breathing here. We simply help them stay with what is present. Therapist stance in incubation phase. Quiet presence. Minimal verbal guidance. Gentle contact where awareness collapses, as you already do. Encouraging curiosity rather than effort. This phase lays the groundwork for deeper process. 2, trembling, discharge phase. As the breath continues and awareness deepens, the nervous system may spontaneously initiate trembling, shaking, twitching, or vibratory release. This is part of the body's self-regulating discharge of the sympathetic activation held from trauma. Clients may experience shaking in hands or legs, quivering in the jaw or lips, spontaneous sighs, yawns, or changes in breath, thermal waves, heat spreading, cooling. This is not something we induce, it is something we follow. Our job is to help the client allow this without fear or overwhelm. We may say, yes, stay with that. Let the body do what it needs to do. You're safe, I'm here. This phase is often where autonomic flexibility begins to return. 3, emotional phase. Emotional phase. As sympathetic charge discharges, emotion becomes available in a clearer, more regulated way. This is not catharsis. This is emotion felt in the body, in the present moment, without collapse. Clients may cry without losing contact with themselves, feel waves of grief, anger, relief, or tenderness. Remember something without reliving it. Speak a truth they have never spoken before. We are supporting embodied emotional expression, not emotional overwhelm. The goal is integration, not release. Therapist stance in emotional phase. Stay steady and grounded, slow pacing. Reflect reality without interpreting. Allow emotion, but do not push for more. The emotional phase resolves naturally when the client has felt their experience in the body, seen it held in safe relational space, return to a feeling of being here. Final considerations: therapist embodiment and presence. A key element in trauma work is that the practitioner must remain deeply regulated within themselves. Our own body is the primary instrument we use to help our clients stay connected to their experience without being overwhelmed. The more we are able to remain grounded in our own bodies, sense our own breath and posture, stay emotionally steady and curious, the more we can serve as a co-regulating presence for our clients. In other words, we do not lead clients into deeper intensity. We accompany them into deeper presence. Our steadiness is more important than our technique. The importance of pacing. We must remember, trauma is not resolved through intensity. Trauma is resolved through differentiation and integration. We support our clients by slowing down, tracking subtle shifts, reflecting the present moment, encouraging choice, honoring their pace. The goal is not dramatic release. The goal is autonomic flexibility restored through safe, embodied awareness. Ending a session. We close by helping the client reorient to the room, feel their spine and feet, notice their breath in real time. Speak one or two simple statements of what they experienced. We do not analyze or interpret the content. We simply help the client land in themselves. The essence of this work is presence, pacing, and permission, not pushing, fixing, or catharsis. Reintegration and aftercare. After somatic trauma work, clients may feel open, tender, quiet, spacious, or somewhat disoriented. We encourage drinking water, resting, being in natural environments, brief journaling without analysis, avoiding major interpersonal conflict for the rest of the day. This allows the nervous system to complete the integration cycle without interruption. We remind clients that nothing needs to be understood quickly. The insights will settle over hours or days. Their system is reorganizing. We close with warmth, grounding, and clear presence. And now that I'm reading this, I realize this was Perry who wrote this, because it's referencing Deep Bodywork. So I'll check in with Perry before making this available.